Last time we talked about the Centers of Disease Control and Prevention's funding announcement, Comprehensive HIV Prevention Program for health departments, and the impact that it will have on African American agencies. The question I left you with was, how did long-standing African American agencies start discussing closing their doors? Who is to blame? I believe nobody and everybody. I know it doesn't make sense, but we all could have done a better job of preparing for the HIV prevention shift that we are now facing. At the same time, we thought we were preparing for the shift. But such major changes to happen in a fragile funding environment now has health departments and community-based organizations thinking differently how they have to conduct business. Now, for years, we've talked to community-based organizations about diversifying their funding streams, never depending on one source, such as the state health department. When you do that, and a contract isn't renewed or is significantly reduced, it becomes a greater liability to the agency if that is your primary funding source. There has to be a combination of state, federal, private resources, and fundraising. And remember, CDC is not the only federal funder for HIV funding. Visit AIDS.gov and review the federal implementation plan for the National HIV/AIDS strategy. It lists all the federal agencies that have to respond to the strategy. Find out if there is funding being allocated for HIV services in your jurisdiction that you can apply for. Then contact the federal agency. If nothing else, you begin to open a dialogue and become familiar with their contribution to HIV prevention in your jurisdiction. Now, we have some state health departments who receive HIV funding from CDC. They receive funding from other federal agencies, as well as state funds for HIV care and prevention. Some also have financial partnerships with other state organizations and even private organizations such as the Robert Wood Johnson's Foundation. Even though we know some states have been hit hard by budget cuts from their state government and some from CDC, it forced them to start looking at restructures that may include a reduction of staff, may also include a reduction of funds to community-based organizations. But because they had diverse funding streams, they were able to implement or integrate programs, I should say, together so that they didn't lose the continuity of HIV prevention services. Now, if you are a state program where the only funding stream was the cooperative agreement, and you see a reduction in your cooperative agreement, then it causes severe challenges, not only for the health department, but it also causes challenges for the community-based organizations who depend on funding from those health departments. Now, as a former state prevention director, I know that making decisions about educating elected officials or entering into financial agreements with other state organizations is not decided on at the program level. But you can educate the AIDS directors, the division directors, the commissioners of health on the need to have these funding streams in addition to your CDC cooperative agreement. Now, speaking of CDC, before the FOA was released, CDC held listening sessions, they held conference calls to allow input from across the country. Some people participated, some didn't. Now, I don't believe in pointing the finger at one entity when HIV is a problem, including the funding hardships that come along with it. It's all of our problem. But were there additional activities by CDC that could have occurred before the release of the FOA? Maybe listening sessions only with executive directors that would have given them an opportunity to hear from the leadership in the community of how the FOA will impact communities across the country. Maybe identifying agencies in the southern region and meeting with them or meeting with their entire staff to hear how the change will affect at all levels within an organization. And I keep referencing the southern region because that's where we see the highest number of AIDS and HIV cases in black communities. Could CDC have met with state jurisdictions and agencies together to hear how the FOA would affect their state? Are these possible activities that we could see from CDC 3 months or 6 months after the funding cycle has started to see how health departments or community agencies are adapting to the change? Now, here's the real question. What will be the impact for black communities if agencies in their community begin to close? Will we see funding reduced or testing, HIV testing in black communities where it was offered free? Where will individuals go now? Because remember, all health departments, all local health departments do not offer free HIV testing. Are we now saying that interventions such as SISTA and Voices that we've conducted training for to ensure that they're widely available, and that agencies that were implementing these interventions in housing projects and in historical black colleges and universities, that they will no longer be in effect? And if we're saying that, are we saying that those interventions didn't work before? Who will conduct street outreach that includes condom distribution, which is a key component to the reduction of HIV infection? Where will these services come from? So I still ask, where do we go from here? Is there a way to save organizations, specifically black agencies in the southern region, where we see some of them are now on life support? In the meantime, to those organizations who are facing closing, don't give up. It's always the hardest to start a fund development plan when you're in the midst of the crisis. I know, I've been there. When you're so concerned about making payroll this week, it's very hard to talk about planning to receive money that you may not get from 6 months to a year from now. But you have to have a fund plan. It's to help for the long haul for the organization's survival. Both health departments and community agencies use the capacity building agency providers that we already have in this country. Health departments have NASDAD, the National Alliance of State and Territorial AIDS Directors. You can find out more information and resources at nasdad.org. For city health departments, you can find information out at uchaps.org. And for our community agencies, you too can find additional resources at the Black AIDS Institute at blackaids.org or at the National Minority AIDS Council at nmac.org. Remember, history will record our commitment to stop the spread of HIV and AIDS. God bless.